Welcome. Have you ever experienced a sudden, sharp pain radiating down your arm after an injury? It might be more than just a simple strain. Today, we're delving into the complex world of the brachial plexus and exploring what happens when it's injured. We're talking about brachial plexus injury, a condition that can significantly impact movement and sensation in the arm and hand. So, what causes this type of injury? Brachial plexus injuries most commonly occur due to trauma. Think car accidents, motorcycle crashes, or falls where the shoulder is violently stretched, pulled, or compressed. In newborns, it can happen during a difficult delivery, especially if the baby is large or there are complications. Less common causes include tumors pressing on the plexus, inflammation, or radiation therapy to the chest area. To understand brachial plexus injuries, we need to understand the brachial plexus itself. Imagine a network of nerves originating from the spinal cord in your neck, specifically from levels C5 to T1. These nerves branch out and travel down the shoulder and arm, controlling muscle movement and sensation in the upper limb. When this network is stretched, compressed, or torn, the signals traveling through these nerves are disrupted, leading to weakness, numbness, and pain. The severity of the injury depends on the extent of the damage to the nerves. It could range from a mild stretch, called a neuropraxia, to a complete avulsion, where the nerve root is torn completely from the spinal cord. Brachial plexus injuries affect individuals of all ages, but there are certain groups at higher risk: newborns experiencing difficult deliveries, young adults involved in contact sports or high-speed accidents, and older adults with underlying conditions like tumors are more susceptible. Accurately pinpointing the exact prevalence is challenging due to variations in reporting and the wide range of injury severity. However, studies indicate that brachial plexus injuries are a significant cause of disability, particularly among young and active individuals. The signs and symptoms of a brachial plexus injury can vary greatly depending on the specific nerves affected and the severity of the damage. Common symptoms include weakness or paralysis in the arm or hand, numbness or loss of sensation in the shoulder, arm, or hand, and severe pain that may feel like burning or electric shocks. In some cases, there might be muscle atrophy or wasting due to the lack of nerve stimulation. A classic sign in newborns is Erb's palsy, where the arm hangs limply at the side, with the hand rotated inward, sometimes referred to as the waiter's tip position. Diagnosing a brachial plexus injury involves a thorough physical examination, a review of the patient's medical history, and often, diagnostic imaging. During the physical exam, the doctor will assess muscle strength, reflexes, and sensation in the affected arm. Nerve conduction studies and electromyography, or EMG, help measure the electrical activity of the nerves and muscles, revealing the extent of nerve damage. Imaging techniques like MRI can visualize the brachial plexus and identify nerve compression, tumors, or nerve root avulsions. Brachial plexus injuries can be classified according to the severity and location of the nerve damage. Neuropraxia, as mentioned, is the mildest form, involving a stretch injury without nerve tearing. Axonotmesis involves damage to the nerve fibers, but the surrounding connective tissue remains intact, allowing for potential regeneration. Neurotmesis is the most severe, involving complete severance of the nerve, often requiring surgical intervention. Injuries can also be classified based on the location of the damage within the plexus, such as upper plexus injuries affecting the shoulder and upper arm, or lower plexus injuries affecting the forearm and hand. Treatment and management of a brachial plexus injury depend on the severity and type of injury. Mild cases may resolve on their own with conservative management, including pain medication, physical therapy, and occupational therapy. Physical therapy focuses on restoring range of motion, strengthening muscles, and preventing contractures. Occupational therapy helps individuals adapt to their limitations and regain independence in daily activities. More severe injuries may require surgical intervention. Nerve grafting involves using a healthy nerve from another part of the body to bridge the gap in a damaged nerve. Nerve transfer involves rerouting a less important nerve to restore function to a more important one. In some cases, reconstructive surgery, such as tendon transfers, may be necessary to improve arm and hand function. Preventing brachial plexus injuries involves taking precautions to avoid traumatic events. Wearing seatbelts in vehicles, using proper protective gear during sports activities, and preventing falls, particularly among older adults, can significantly reduce the risk. For newborns, careful obstetric techniques and management of shoulder dystocia during delivery can help prevent birth-related brachial plexus injuries. The prognosis for a brachial plexus injury varies widely depending on the severity and location of the injury, the individual's age and overall health, and the timeliness and effectiveness of treatment. Mild injuries, such as neuropraxia, often have a good prognosis with full recovery within a few weeks or months. More severe injuries may result in permanent weakness or paralysis despite treatment. Ongoing research is exploring new strategies for nerve regeneration and functional restoration. Promising areas of research include the use of stem cells to promote nerve growth, advanced surgical techniques to improve nerve repair, and the development of prosthetic devices to enhance function. The future holds hope for improved outcomes for individuals with brachial plexus injuries. Remember to always consult with medical professionals for accurate diagnosis and treatment.